The relationship between mental health and physical health is a complex and interconnected area of study that has gained significant attention in recent years. One specific area of interest within this broader field is the correlation between depression and muscle mass. This topic explores how physical attributes, particularly muscle mass, influence mental health outcomes such as depression and vice versa. A growing body of research indicates that there is a meaningful connection between these two aspects of health, suggesting that maintaining muscle mass through regular physical activity may play a role in mitigating depressive symptoms. Depression is a common mental health disorder characterized by persistent feelings of sadness, loss of interest or pleasure in most activities, changes in appetite and sleep patterns, and difficulty concentrating. It can have a profound impact on an individual's quality of life, affecting their emotional, cognitive, and physical well-being. The causes of depression are multifaceted, involving genetic, biological, environmental, and psychological factors. Traditional treatment approaches often include psychotherapy, medication, and lifestyle modifications such as exercise. Muscle mass, on the other hand, is a measure of the amount of muscle tissue in the body. It is an important component of overall physical health, influencing metabolic rate, physical strength, and mobility. Muscle mass tends to decrease with age, a condition known as sarcopenia, which can lead to a range of health problems, including increased risk of falls, fractures, and metabolic disorders. Maintaining muscle mass through strength training and physical activity is crucial for overall health and well-being. Research exploring the link between depression and muscle mass has produced several key findings. One significant line of inquiry has focused on how physical activity, particularly resistance training, can influence depressive symptoms. Numerous studies have demonstrated that engaging in regular physical exercise can have a positive impact on mental health, reducing symptoms of depression and anxiety. Exercise is thought to affect mental health through several mechanisms, including the release of endorphins and other neurotransmitters, improved sleep patterns, and enhanced self-esteem and body image. For example, a study published in the Journal of Psychiatric Research found that individuals who participated in a structured resistance training program showed significant reductions in depressive symptoms compared to those who did not engage in such activities. The researchers suggested that the increase in muscle mass and strength from resistance training might contribute to these positive mental health outcomes by improving body image and self-efficacy, reducing physiological stress responses, and enhancing overall physical health. Another important aspect of the relationship between depression and muscle mass is the role of inflammation. Chronic inflammation has been implicated in the pathophysiology of both depression and muscle wasting conditions. Depressive disorders are often associated with elevated levels of pro-inflammatory cytokines, which can adversely affect brain function and mood. Similarly, muscle atrophy and sarcopenia are linked to inflammatory processes that degrade muscle tissue. Exercise, particularly resistance training, has been shown to reduce markers of inflammation in the body, potentially mitigating both depressive symptoms and muscle loss. A study published in the American Journal of Psychiatry investigated the impact of exercise on inflammatory markers and depression. The findings indicated that participants who engaged in regular physical activity had lower levels of inflammatory cytokines and reported fewer depressive symptoms compared to sedentary individuals. This suggests that maintaining muscle mass through exercise could help modulate inflammatory responses, thereby reducing the risk of depression. The psychological benefits of increased muscle mass and physical strength can also play a crucial role in the relationship between depression and muscle mass. Enhanced physical strength and fitness can lead to improvements in self-esteem, confidence, and overall mood. Individuals who feel stronger and more capable in their physical abilities are likely to experience a sense of accomplishment and well-being, which can counteract depressive symptoms. Additionally, the social interactions and support that often accompany group exercise activities can provide emotional and psychological benefits, further reducing the risk of depression. Furthermore, studies have shown that physical inactivity and low muscle mass are associated with higher rates of depression in various populations, including older adults, adolescents, and individuals with chronic health conditions. For instance, research published in the Journal of Affective Disorders found that elderly individuals with lower muscle mass were more likely to experience depressive symptoms compared to their peers with higher muscle mass. This association was independent of other factors such as physical health status and socioeconomic conditions, highlighting the specific impact of muscle mass on mental health. The bidirectional nature of the relationship between depression and muscle mass is also an important consideration. While low muscle mass can contribute to the development of depressive symptoms, depression itself can lead to physical inactivity and muscle atrophy. Depressed individuals often experience fatigue, low energy levels, and a lack of motivation, which can result in decreased physical activity and subsequent muscle loss. This creates a vicious cycle where depression and muscle atrophy reinforce each other, exacerbating both conditions. Intervention strategies aimed at breaking this cycle often involve promoting physical activity and strength training as part of a comprehensive treatment plan for depression. Exercise programs tailored to the individual's physical capabilities and preferences can help increase muscle mass, improve physical fitness, and alleviate depressive symptoms. Health professionals, including psychologists, psychiatrists, and physical therapists, play a crucial role in designing and implementing these interventions. One study published in the Archives of Internal Medicine examined the effects of a 12-week resistance training program on older adults with depressive symptoms. The results showed significant improvements in both muscle mass and depressive symptoms among participants who completed the program. The researchers concluded that resistance training could be an effective adjunct therapy for depression, particularly in older adults at risk for sarcopenia and physical decline. In addition to structured exercise programs, lifestyle modifications that promote physical activity and healthy aging are essential for maintaining muscle mass and mental health. Encouraging individuals to engage in regular physical activities such as walking, gardening, and recreational sports can help preserve muscle mass and prevent the onset of depressive symptoms. Nutrition also plays a critical role, as adequate protein intake and nutrient-rich diets support muscle maintenance and overall health. The relationship between depression and muscle mass is also influenced by various sociodemographic factors, including age, gender, and socioeconomic status. Research indicates that these factors can modulate the impact of muscle mass on mental health outcomes. For example, studies have shown that the protective effects of muscle mass against depression may be more pronounced in older adults, who are at higher risk for both sarcopenia and depression. Gender differences have also been observed, with some research suggesting that men may derive greater mental health benefits from increased muscle mass compared to women. Socioeconomic factors, including access to resources such as fitness facilities and nutritious food, also play a role in the relationship between muscle mass and depression. Individuals with limited access to these resources may face greater challenges in maintaining muscle mass and managing depressive symptoms. Public health initiatives aimed at reducing barriers to physical activity and promoting healthy lifestyles are crucial for addressing these disparities and improving mental health outcomes across different populations. In conclusion, the correlation between depression and muscle mass is a multifaceted relationship influenced by biological, psychological, and social factors. Research indicates that maintaining muscle mass through regular physical activity, particularly resistance training, can have significant benefits for mental health, reducing the risk of depression and alleviating depressive symptoms. This relationship is mediated by various mechanisms, including the modulation of inflammatory responses, improvements in self-esteem and physical fitness, and the psychological benefits of social interactions and support. Understanding this connection is essential for developing effective intervention strategies that promote both physical and mental well-being. Health professionals and policymakers must work together to create environments that support physical activity and healthy aging, thereby enhancing the overall quality of life for individuals at risk of depression and muscle atrophy.